Welcome back to the show. Prescription weight loss medications are getting more attention these days, but there's so much we don't know. Here to break down the pros and cons and everything in between is Chief Medical Officer of WebMD, Dr. John Whyte. Hi, Dr. John. How are you? Welcome back.
Thank you. All right. We keep hearing about the promising results of these medications for some people. Break down how they work.
Sure. So these medications, typically called GLP-1s, glucagon-like peptide-1, they basically work by regulating food intake and appetite. So what they do is they mimic a hormone that tells your brain you're full, so you don't eat as much. They slow down your stomach from emptying. So if your stomach is full longer, you don't eat as much.
Are some people like missing that hormone, the thing that tells them that their brain is full?
You know, a lot of the times people are eating so quickly, kind of like that dashboard dining. They don't have a chance for their stomach to signal to their brain, hey, I'm full. Right. So you overeat. These also help regulate blood sugar, so they make your body more sensitive to insulin. So, you know, sometimes we have these ups and downs of blood sugar. That's not good when it comes to cravings.
And so that was really what a lot of these medications were invented for, right? The control of the blood sugar for diabetes.
They started as diabetes drug. For obesity, they're at a little bit of a different dosing, but fundamentally, they were discovered for diabetes.
Okay, so what are some of the other pros besides the controlling of the diabetes?
Sure. So we know for weight loss what we're talking about. So at 4 months on these drugs, most people lose about 5 to 10% of their body weight. And at a year, it's typically about 15%. So if you're 200 pounds, you're going to lose about 30 pounds.
Got it. I was going to ask you to put that into pounds for me because I can't do percentages.
Okay, so about 30 pounds if you're 200.
So it's effective weight loss.
It is effective weight loss. It's also what we see is improving your metabolic health. So now your blood pressure's under better control. Your lipid panel, that bad cholesterol, LDL, is better, and so is your good cholesterol, HDL. These drugs actually are now indicated for people who have diabetes and heart disease. They may reduce your risk of another heart attack or stroke. And what's really exciting is, in about 13 cancers, we're starting to see decreased risk.
No kidding.
Like pancreatic cancer, for which we do not have good treatments for as much as we should.
No kidding.
Yes, colorectal cancer, endometrial. Some's probably due to obesity, but others is because of inflammation, chronic inflammation, which we know is bad when it comes to cancer. So that's what I'm really excited about as well.
Okay, what about some other conditions it can reduce the risk of?
We know the importance of sleep, and 30 million people have sleep apnea. So they're not sleeping well, and their partners aren't sleeping well either.
Can we put Mark on this medication?
We should talk about it
Even if he doesn't need to control his weight, what if he just snores a lot?
And that, you know, maybe this will help. We'll see.
Because they lose weight? You think that's what it is?
It's both. So it's reducing the amount of fat in the neck, which is often a cause, because your airway doesn't stay open. So if you have less fat and more space, your airway is going to stay open. And then the inflammation. So if I reduce swelling that's going on there, that airway will stay open and I'll breathe easier.
Okay.
I keep reading, my news feed is clogged with articles about GLP-1s. They're saying that some of it can be used to treat addiction.
We are starting to see that.
Like food addiction?
Actually, addiction for things like nicotine, alcohol, other drugs, because just as we are doing for food, we're reducing that reward that you have when you eat sugar, right? So I'm delaying it, partly by the way that glucose is absorbed. I'm doing the same things, activating certain areas of your brain, so I'm gonna delay that sense of euphoria, or reward, from smoking, or drinking alcohol, or using illicit drugs. So that can be very powerful in terms of being able to impact addiction.
Okay, we're gonna take a little break, but come up next, it's not all good stuff. There are some negative side effects. We're gonna check those out.
We are back with Dr. John Whyte, who is discussing everything we need to know about these weight loss medications. They're very popular in the drug industry, pharmaceuticals. It seems like every commercial I watch is for a weight loss drug. When something seems too good to be true, it usually is. So walk us through what the common
Sure.
side effects are.
And 6% of Americans are on these drugs.
6%?
6%.
I feel like I know all 6%.
Yeah. You know, with every drug, there are risks and benefits. There are no magic pills. So for these drugs, it's typically things like nausea, vomiting, diarrhea, because we're talking about the gut. About 5% of people, the symptoms are so severe, they have to come off of it. But for other people, typically in a month, they get better. We can also see headache, constipation. There is a rare condition that we recently just took notice of. It's an optic neuropathy. What that means is your optic nerve, which feeds your eye, doesn't get enough blood supply. So it could cause blindness.
Oh my
So
gosh.
that's something that we need to be aware of. And it's really exciting because blood sugar impacts the shape of our lens. So sometimes early on, people will say to me, Dr. Whyte, I feel like my vision was kind of blurry. That usually resolves in about 4 weeks.
So when they take the drugs, they feel
It's
like
because
they're
of the blood sugar in terms of how your blood sugar is being regulated.
So interesting.
The other thing I want to remind people that are having some surgical procedure that's not emergent, usually you have to stay off these drugs for 1 to 2 weeks. And sometimes people forget because they may just inject once a week and that can delay surgeries. I've seen several surgeries delayed because people didn't wait long enough because, remember, it's delaying your gut from emptying.
Okay.
So
Got
you
it.
really have to
What are
go.
some other cons?
Some other causes in terms of...
Cons.
Cons.
Oh, the cons, yeah. You know, we really have to think about, it can be low blood sugar as well, right? Because these are managing your blood sugar.
So you could develop.
It could get too low,
Got it.
and then you could get dizzy and other aspects.
And it's expensive. That's one of the cons, too.
It is expensive. So it's about...
It's not covered by health insurance.
It's about $1,300 a month. So if insurance covers it, they may not cover all of it. They may only cover it for a certain period of time. That's a lot of money for people.
And these things don't work just by themselves. You have to make other changes as well.
I'm glad you brought that up because I saw a patient the other day and I said, wow, you know, like you've lost 20 pounds. What have you done? And she said to me, honestly, Dr. Whyte, I didn't do anything. She said, I just took the drug. And she lost weight. And really what I had to revisit with her is food is medicine. You still have to eat healthy. You still have to have fruits and vegetables. You can't just eat less hamburgers, hot dogs, and chips. That's not going to get you to where you need to be in terms of your health.
And people are losing muscle mass because muscle weighs more than fat.
Yeah.
And is the muscle the first thing to go?
You know, that's exactly right, Kelly, and that's what I'm concerned about, this concept of sarcopenia, which is loss of muscle mass. So roughly 40% of your weight loss is muscle. And as we get older, we lose muscle mass. So this is a real concern, especially for people that are over 40 and 50 that are losing muscle mass, because it's not easy
No,
to
it
get
naturally goes
to
away.
get
You
back.
don't need a drug to help it along.
That's why you still need to be doing strength training. You still need to be doing resistance exercises and cardio, even when you're on these drugs.
Interesting. Okay. Well, thank you. And how long do people need to stay on these drugs before we go?
Right now, we're saying you have to stay on it for the rest of your life.
For the rest of your life.
Because what we've seen is 20%
People
of
gain it
people,
back.
2/3 of it back. They
Right.
regain it.
Right.
So I think that's partly because people aren't doing the things that we just talked
Right.
about. They're not eating healthy. They're not changing their lifestyle. They're just eating less of what they were.
And do they know what the long-term effects are of, I mean, is it too soon to tell? Are we living in the generation of the experimental people?
Well, that's why it's so important to talk to your doctor before you start these drugs, because these were studied in smaller populations. Now we're talking 6% of the population and growing. Sometimes it takes a while before you know what some of the effects are. So we need to stay vigilant about this. And if you don't need to take a pill or an injection, you know, focus on lifestyle too and see how that will help.
Thank
Okay.
you so much
Thank you.
for all
Thanks
this
for having me.
information.
For more important health information, be sure to pick up a copy of Dr. Whyte's book, Take Control of Your Diabetes Risk. We'll be right back.